Swayam Prabha. Digital India. Educated India.
Hello everyone. So today we'll start our next lecture, that is autonomic function test, that is lecture number 2. Already we had discussed in the previous lecture the various types of autonomic functions test, starting from Valsalva Monova deep breathing test and hand grip test, then cold pressor test. So now we will see what are the available methods are there for autonomic scoring or how this scoring is done. So we have done the test, now we need to score or we have to quantify to check for the degree or the severity of the autonomic dysfunction. So why there is a need for reporting of autonomic function test? As I had already told you, to recognize the presence of autonomic dysfunctions with the help of test you would be able to recognize where the dysfunction is. Then you want to check whether the sympathetic loop has got any problem or the parasympathetic loop has got any problem. So, which the site of problem needs to get detected. Then the severity, the degree of the severity of the dysfunctions, autonomic dysfunctions needs to get elucidated, and the therapeutic implications, like if you are giving any cholinergic drugs or anticholinergic drugs, adrenergic drugs, noradrenergic drugs you are giving. So, or beta blockers, alpha blockers. So, what are the implications of those drugs which could modulate the functions of autonomic nervous system and predict the mortality risk in the subjects. So, initially this autonomic function test has been a very daunting task, because there is not only one test you are supposed to do which could finally give rise to the autonomic dysfunctions or relate to the autonomic dysfunctions. You have to run a battery of tests. So, in 1981, Ewing's method has, or the scientist Ewing has usually done this battery of 5 tests, or this tests are finally named after the scientist Ewing. So, there are 5 phenomena or 5 parameters, that means Valsalva ratio. During 3 Valsalva maneuvers we are supposed to do 3 Valsalva maneuvers. Then mean we have to go for 6 deep breathing. Then we have to check for the mean of the maximum and the minimum heart rate differences in the deep breathing, that means delta heart rate we have to check. In the 3 Valsalva maneuver we have to check for the Valsalva ratio, and then we have to check for the delta heart rate in the deep breaths. Then 30:15 ratio after standing, systolic blood pressure fall, the fall of the systolic blood pressure after standing. When we stand up, there is a fall in the systolic blood pressure. How much is the fall we have to see? And diastolic blood pressure rise during hand grip. Whenever we do a sustained hand grip isometric exercise, what is the rise in the diastolic blood pressure we have to see. So, these are the 5 battery of 5 tests which is been considered one of the symptomatic for important for by Ewings. So, the cutoff values for autonomic function test using this 5 test, we would see the deep breathing test, delta heart rate more than 15, more than equal to 15 beats per minute is usually considered to be normal. Now, all the tests are usually considered to be either normal or borderline or abnormal. So, these 3 entities are there. Either the test should conclude one as normal, then borderline or abnormal. So, deep breathing test 15, more than 15, you have to remember this cutoff values. More than 15 equal to 15 is normal, 10 to 15 is borderline, less than 10 is abnormal. Similarly, the Valsalva ratio is very important. More than 1.21 is the normal value of the Valsalva ratio. Within 1.2, that is borderline, and less than 1.1 is abnormal. Then we have change in the diastolic blood pressure. Whenever there is a rise in the diastolic blood pressure of more than 16 millimeter of mercury, it is normal. Less than 16 millimeter of mercury, again whether it is 11 to 15 it is borderline, less than 10 it is abnormal. When the systolic blood pressure generally usually falls within 10 millimeter of mercury, so this is normal. But if the difference is more than 10, suppose 10 to 19 it is borderline, more than equal to 20 it is abnormal. And 30:15 ratio, again 1.04 is the cutoff value, more than equal to 1.04 is normal, 1.01 to 1.03 is borderline, and less than 1.01 is abnormal. So, based on this category and criteria, we usually classify whether the person is having normal, borderline or abnormal autonomic dysfunctions. Now, Ewing's method, based on this autonomic scoring, we will classify this CAN or cardiac autonomic neuropathy as normal, early, definite or severe. So, normal means all tests are normal or one test is borderline. Early impairment means one of the three heart rate test is abnormal or two borderline. Now, heart rate means we are talking about the delta heart rate in case of Valsalva ratio, and in case of the 30:15 ratio. So, other we have the blood pressure, that means change in the diastolic blood pressure and the fall in the systolic blood pressure. So, and in the Valsalva ratio also. So, the one of the three heart rate test which is abnormal, and then definite two heart rate test, heart rate and blood pressure both we have in case of Valsalva actually. So, two heart rate test is abnormal in case of definite. In severe, two heart rate and one or both blood pressure test is abnormal. So, normal, early, definite, severe. All are normal, all tests are normal, or one test is borderline, that is normal. Early impairment or earlier cardiac autonomic neuropathy means one of the three heart rate tests should be abnormal or should lie in the borderline. Definite means two heart rate has to be abnormal, heart rate test have to be abnormal. Severe means either two heart rate has to be abnormal and one blood pressure has to be abnormal, or both blood pressure test can be abnormal also. So, in this way we classify this cardiac autonomic neuropathy or CAN. Later on in 1983, another criteria has had come up, that is Bellavere criteria. Bellavere criteria consisted of deep breathing test, Valsalva monomer and hand grip test. It omitted the standing lying position and 30:15 ratio. So, delta heart rate, Valsalva ratio and change in the diastolic blood pressure, this we have to see. Usually the criteria remains the same, only we have given the score of 0, 1 or 2, which means the highest score in case of abnormal is 2, in case of Valsalva ratio is 2, in case of hand grip test is also 2, that means the highest score has to be 6. If the person is having the score as 6, that means the cardiac autonomic neuropathy is severe in that person. So, in that way we will see the scores when added, the cardiac autonomic neuropathy CAN is classified as 0 to 1 in, that is no cardiac autonomic neuropathy, 2 to 3 early cardiac autonomic neuropathy and 4 to 6 that is severe cardiac autonomic neuropathy. Later on O'Brien in 1986 has classified another battery of tests which is almost similar to Ewing's test, but only difference is only one Valsalva monomer is done instead of 3, only one deep breath is taken instead of 6. So, this actually reduces the time consumption or time taken to perform all the battery of tests. So, that is more comfortable of the patient and much quicker. The systolic fall is already taken, diastolic change during hand grip is also taking, and deviations of the RR interval during quiet breathing, that is the delta RR during the quiet breathing, that is also taken. So, this is usually the classification done by O'Brien. So, generally we follow the Ewing's method or the 5 battery of test. So, these tests are again further divided based on the sympathetic component and the parasympathetic component. So, we will see whether Valsalva checks for the parasympathetic component or not, or whether hand grip checks for the sympathetic component or not. So, deep breathing test and Valsalva usually check for the parasympathetic component. Hand grip test and cold pressor test, this usually check for the sympathetic component. Standing to lying test, or we have the head up tilt test when we have a automated tilt table. So, we can go for the head up tilt test. They usually check for the parasympathetic component as well as sympathetic component. Now, in case of parasympathetic component, that is usually 30:50 ratio we check for in case of standing, lying to standing or head up tilt. In case of sympathetic component, in lying to standing or head up tilt, we usually check for the blood pressure, that is change in the systolic blood pressure. Here we go for the heart rate. Usually in case of parasympathetic component, in sympathetic we check for the blood pressure, in parasympathetic we check for the heart rate. So, these are the 6 tests which are divided as per the sympathetic domain and the parasympathetic domain. Deep breathing, Valsalva for sure parasympathetic, cold pressor test and hand grip is for sympathetic. Standing to lying, lying to standing or head up tilt goes both for parasympathetic as well as sympathetic. Only heart rate 30:15 ratio is checked in case of parasympathetic component, and the blood pressure fall is checked in case of sympathetic component. Now, disadvantages while performing this autonomic function test, as I had told you that the sympathetic component Ewing's criteria has used the sympathetic component for diagnosis of the severity of the cardiac autonomic neuropathy, and sympathetic dysfunctions need to get assessed independently, not in combination with parasympathetic. There is overlapping of the test, and sympathetic abnormality is more common than the parasympathetic component, and one abnormality may not follow the other. That means not necessarily the parasympathetic dysfunction is followed by sympathetic dysfunction. So, to compensate this, we have the CAS scores, that is composite autonomic severity scores. This is usually developed by the Mayo Clinic. This composite autonomic severity score, or in short form we tell as CAS, this considers the 3 domains mainly based on the sub scores, that is cardiovagal, adrenergic and pseudomotor. So, cardiovagal is mainly the heart rate of deep breathing and Valsalva maneuver. Adrenergic is mainly the blood pressure of Valsalva maneuver and tilt test, whatever the changes in the blood pressure. And we get to check the pseudomotor test, that is the QSAT or quantitative sweat axon reflex test. In general we call it as QSAT, quantitative sweat axon reflex test. So, subscores we have cardiovagal, adrenergic and pseudomotor. So, in case of pseudomotor, or how quantitative sweat axon reflex test, usually we see this ionophoric drug delivery system is there via electrodes, that is usually placed in the proximal part of the wrist and also in the 3 sides of the right leg at the region of distal region, proximal region of the leg and the foot region along with the ground electrode, and then we check for the sweat response. So, quantitative how this QSAT or quantitative pseudomotor axon reflex test is done, this usually check for the latency and the sweat volume or the volume of sweat. Now, this electrode this usually consists of 10% acetylcholine solutions, and this is mainly because we have to pass on 2 milliampere current. So, that for that reason usually this acetylcholine solutions for the conductivity, this is usually present in the electrode. So, the volume of sweat, how much it is generated and the latency, that is usually calculated or measured in case of quantitative pseudomotor axon reflex test. Now, you in the diagram which we see, this is the time and the sweat rate. So, this is where the stimulus is given, this is the stimulus, and this is where the sweating has start, that means onset of sweating. So, this period is latency, and from here till here we get the sweat volume or volume of sweat. So, in this way we can calculate the latency and the volume of sweat in the QSAT. So, based on this sub scores, the composite autonomic severity score CAS. So, cardiovagal sub score 0, 1, 2, 3, the normal value is 0, 1 is the heart rate due to deep breathing or the Valsalva ratio which is reduced. In case of this reduction has to be more than or equal to 50% of the minimal normal value. In case of deep breathing heart rate, or if the Valsalva ratio is reduced to less than 50%, then it is second, and when both are reduced to less than 50% of the minimum normal value, then it is considered to be third point. In similar case, the adrenergic score 0 is the normal value, 1 depends on the early phase 2 reduction, then latent the late phase 2, if it does not return to the baseline, what is the pulse pressure reductions and what is the systolic blood pressure recovery. If it is not done, if the recovery is not set between 4 to 5 seconds, then it is 1. If the recovery is not done within 6 to 9, before 6 to 9 seconds, then it is 2. If the recovery is taking more than 10 seconds, then it is 3 and 4. Now, in generally adrenergic subscore 3 and 4 states about your orthostatic hypotension, where the systolic blood pressure reduction is 30 millimeter of mercury and mean blood pressure is reduced by 20 millimeter of mercury. So, this usually give the scores of 0, 1, 2, 3, 4. So, here in adrenergic the highest score abnormal score is 4, the highest abnormal score in cardiovagal subscore is 3. So, this gives the total score of 7. Also, we have now the pseudomotor subscore. So, pseudomotor subscore 0 is the normal value. In 1 point we have single site abnormal and more than 50% of the lower limit. In 2 we have single site less than 50% of the lower limit, or 2 or more sites reduced or more than 50% of the lower limit. When 2 or more sites are more than less than 50% of the lower limit, that is 3. So, third point or 3 point is the pseudomotor subscore. So, that means 7 and 3 10. So, 10 is the highest score in case of CAS. So, that is why now autonomic failure, here when we are talking about autonomic failure, we are talking about generalized autonomic failure. Generalized autonomic failure, we are not talking only about cardiac autonomic neuropathy, we are talking about generalized autonomic failure. Say in generalized autonomic failure, we have 0 as normal, 1 to 3 as mild, 4 to 6 as moderate and 7 to 10 as severe. Generally, if you get score 1 or more than 1, that means the autonomic neuropathy is significant in that person. So, that is the score higher than 1 is clinically significant and indicates presence of autonomic neuropathy usually. So, this is mainly of the generalized autonomic failure, that means along with the cardiac autonomic dysfunctions, the other systems of our body are also affected, which are usually vagally and mediated, and the sympathetic nerves are also mediating them. So, in the summary, this is an extra edge. The autonomic symptom profile ASP is a well established questionnaire which was designed to evaluate the severity and distribution of symptoms and the autonomic functional capacity of the patients with autonomic disorders. But it used to take huge number of time, like the time it used to take much time, because this usually comprises of 169 questions. They used to assess various domains, generally 11 domains used to get assessed, because when we talk about generalized autonomic failure, we are not only concerned about cardiac autonomic neuropathy, we are concerned about whether the oculomotor reflexes are normal, that means the pupillary light reflexes are normal or not, whether my secretory functions is normal or not, the secretion of the glands, whether my gastrointestinal functions is normal or not, whether the erectile function is there or not. So, there are various domains which are assessed. but since it used to take large lots of time, so a new scale has been developed again by Mayo Clinic, that is Compass 31, that is composite autonomic score. So, this Compass 31 has reduced the 169 questions to 31 questions, and this 31 questions consist of various domains. So, these domains are whether orthostatic intolerance, the questions are asked to assess this whether orthostatic intolerance are present or not. Usually 4 questions are there. Vasomotor function is checked with 3 questions, secretomotor functions 4 questions, gastrointestinal functions with 12 questions, bladder motility 3 questions, and pupillary reflexes or pupillomotor actions with 5 questions. So, totally we have 31 questions, and usually the Cronbach alpha we can see, except in pupillomotor, all are pupillomotor and secretomotor all are usually of more than 0.8. So, it has got a good validity, the internal validity of this scale is good enough. So, that is why along with Compass 31 and CAS score, the autonomic dysfunctions are usually calculated or measured and correlated. So, in this way we can check for the autonomic dysfunction which is present in a body with the help of CAS score as well as Compass 31, which is a well established questionnaire. So, these are the references of today's lecture. Thank you.